I put this slide in because to point out, visually some of the difference in implants. Okay, when we go into the when we go into the lower jawbone to place an implant, it's like going into a block of maple wood. When we go into the upper jawbone to place an implant, it's like going into a block of styrofoam. Okay, that's the difference in density of bone between the upper and the lower. Okay, treating the upper arch is different than treating the lower arch. Okay, Mother Nature compensates for that difference in density of bone. If you look at a lower molar has two roots like this. Okay, now Mother Nature, to compensate for that lack of density in the upper jaw, adds a third root called a palatal root. Here, that root's bigger than the other two roots combined in surface area. So Mother Nature does something to compensate for the difference in density of bone. So when we do our implants, we have to do the same thing. There is no three-rooted implant. Every implant is a cylinder with threads. Okay, got a hole in the middle that holds the screw. Okay, and there can be threads, and you can have lots of threads. You can have a few threads. Every implant manufacturer is different. But if you take a normal thread like this, okay, you get a certain amount of surface area. If you change your thread design, do a square or buttress or a couple of the other thread designs that are out there, you can gain a lot of surface area. You can gain up to 60% more surface area simply by changing the thread design on your implant. So what we use in one area may not be the same as in another area, okay? So not only is there a difference in the strength of the implants, but there's a difference in thread designs as well, okay? And this kind of shows you that the upper jawbone is soft. The upper back tooth area has the softest bone. It takes the most bite force, okay? So in a scenario like this, I like this implant because it's big enough and it has a bunch of threads, okay? This implant you can see is smooth and has 1, 2, 3, 4 very, very small threads. So I don't like that implant in that area.